Hello, everyone. My name is Aldrika Glover Hill, and today we'll be talking about the nurse educator roles. The objectives are that by the end of this lesson, the learner will be able to identify the different roles of the nurse educator, compare and contrast each role of the nurse educator, and provide real life examples of the different nurse educator roles. Key terms are advisor, co learner, mentor, and collaborator. According to Booth, Emerson, Hackney, and Souter, to serve effectively in the role of academic nurse educator, nurses need pedagogical preparation and curricular development, teaching strategies, and evaluation methods. The enhanced learning has led nurse educators into multiple roles, including advisory, co learning, mentoring, and collaborating with other disciplines. Advisor. One of the roles of the nurse educator is to act as an advisor. A nurse advisor helps to guide students with timely completion of the nursing program, so their focus is mostly on academics. The advisor stays in close contact with the student throughout the program as it has a strong rapport to support the student in their academic decisions. The advisor assists with determining what courses are required, such as prerequisites, curricular hours, and they discuss with the student how well they are progressing. The advisor also helps provide input to the student with personal matters since adult learners continuously work to provide for their families while managing their school life. An example of an advisory relationship is the direct communication that I have with Professor Darby. She has given me advice in the BSN and the MSN program. My goal was to graduate this semester. However, I failed one of my classes and was required to repeat the course. Along with along with repeating the course, I only have two preceptorship courses left. So, with me being a wife, a mother, a ICU manager, and I have a small business that I run, Professor Darby just emphasized with me how hard this would be trying to juggle the demands of school and then my personal life. So she and I came up with the decision that I would finish in the spring, take the last part of my preceptorship at that time, graduate, and this right here helped reduce my stress level greatly, trying to figure out how I was going to juggle all of this. Co-learner. The nurse educator functions in the role of co-learner. Nurse educators use knowledge to explore instruction and methods used for teaching. Co-learning involves being active with students, so the nurse educator must be able to analyze and critically apply the knowledge to help empower and motivate students. According to Booth, Emerson, Hackney, and Souter, good teaching means that faculty, as scholars, are also learners. Co-learner can be demonstrated by the instructor-student interaction with practice in the skills lab, testing questions, and performance in the clinical setting. The nurse educator can stay up to date with evidence-based practice changes in the use of learning strategies used, such as with the NCLEX. So, beginning the year 2020, the National Council for State Boards of Nursing will be utilizing a new clinical judgment model, which is tended to make the test more real life for upcoming new nurses. Nurse educators must stay prepared, evaluating the knowledge, skills, and abilities needed by student nurses to make safe judgments and decisions while providing safe care to patients. Mentor. Nurse educators serve in the role of mentor for students, new nurses, and current nurses within the nursing field. Mentors must be experienced and help provide guidance and support on how to deal with the demands of nursing. Mentors should be someone that is caring, connecting, and open to communication. This helps ease the fears and tensions students and new nurses may have while functioning in the practice area. In other words, we don't need a mentor who is not apt to answer questions, who has a negative attitude towards students asking them things. One example I would give of a mentor relationship that I have is with one of the nurses who was We all worked critical care together. And me being a new graduate, I had my first ventilator patient that was on a vasopressor drip, and the drip required being titrated. Being a new nurse, I was so scared. I think I had only been out of school for about 2 months. I pulled out my pocket guide reference book. I kept rechecking the pump, just making sure everything was accurate. And so my mentor finally saw what I was doing and said to me, Adrika, you got this. Stop second guessing yourself. That one statement from her changed my whole life. And she was so supportive. I was able to get advice from her about so many clinical decisions that I did not have ease and comfort with being a new nurse. Unfortunately, my mentor passed away a few years ago, but I will always remember her advice and guidance she gave me and made me feel comfortable as a new graduate. Collegiality. The nurse educator role in collegiality involves working in collaboration with other colleagues, stakeholders such as hospital boards, and lawmakers to enhance the overall learning environment. Collegiality involves being able to make group decision making and working as a team in partnership. An example of collegiality is the partnership with the State Board of Nursing and colleges to promote graduation and passing the NCLEX exam. Nurse educators provide expert opinions to the state boards of nursing when preparing the NCLEX exam. This is done on how student make judgment and is mostly measured from the classroom experience. Nurse educator assists on the panel to write items aligned with the NCLEX exam, and they measure the content to make sure it's accurate. So we know why now our educators have so much knowledge. In conclusion, nurse educator help guide students through the entire learning process and serve in the various roles to help students be successful as nurses. Nurse educators are lifelong learners to ensure evidence-based practice is consistently being met. As nurse educators, we must be the best in teaching the profession of nursing to the future generation and productive in our role of advisory, co-learning, mentoring, and collaboration. Attached is our references.